Welcome to Revelation Revealed Ministry. I'm Norma Hurlock, co-host to this platform. This evening, we continue with the topic fibroids, and we welcome Dr. Joe Daly, who spoke on the topic last week about fibroids. For those of you who missed last week's program, we ask that you go back and you will learn more about Dr. Daly's qualification and work experience. And for those of you who missed part 1, we ask that you go back and listen to part 1 where Dr. Daly spoke about fibroids. And there you will learn about his work experiences and qualification. This evening we continue with the questions on fibroids. Welcome, and Dr. Daly, welcome to Revelation Reveal Ministry.
Thank you very much.
So without further ado, let's get back into our questions.
Okay.
What are some of the early signs and symptoms that indicates the presence of fibroids, and how severe can they get?
Okay. It is important to remember that fibroids can be very silent for a long time. The majority of fibroids do not cause symptoms, and they're only found when a woman is examined internally by her physician or her healthcare provider, or when she has an imaging test like an ultrasound. So if you want to know about the symptoms caused by fibroids, probably the most prominent symptom, the most common symptom, is the presence of heavy menstrual flow. This is the condition for which we treat fibroid disease most often. So a woman will often come to her doctor because she's having very heavy periods, and then investigation will show that the cause of the heavy period, is the presence of these benign tumors of the uterus called fibroids.
Is bleeding always the first sign of fibroids, or there are other signs?
It is almost always the first sign, but there can be other signs. Pain.
Such as?
Pain is reasonably common, but not nearly as common as fibroids, as bleeding. And then there are other things like the presence of a swelling in the abdomen. It is not uncommon for a woman to have a mass about the size of a full-term pregnancy without any symptoms, without any heavy bleeding. So the presence of a mass, the presence of a lump in the abdomen is another sign of a fibroid. And sometimes fibroids only show themselves when a woman is pregnant, for instance, and she starts having problems with the pregnancy. So those are some of the other ways that a fibroid might present. But bleeding is by far, or heavy bleeding is by far, the commonest sign.
How does a woman differentiate between the heavy weight and not just weight gain? How would you tell, oh, I'm just having weight gain, and the next thing you know, you have fibroids?
Well, you know, fibroids don't usually cause a lot of weight gain. The biggest fibroids, certainly probably the biggest fibroid that I've removed, and I've removed thousands of them now, the biggest fibroid would weigh only about 2 to 3 kilograms. There's some giant fibroids that can weigh 30, 40 pounds, but these are extremely rare. So weight gain is not usually one of the symptoms that a woman presents to her doctor with, from which you diagnose fibroids. Okay. So if she gains weight, she'd better first look at what she's eating and not start blaming it on fibroids, because most times it's fat, not fibroids.
Thank you. What impact does the presence of fibroids have on women of childbearing age?
Fibroids can be a real problem for women in the childbearing age group. And just as an aside, again, we're talking here primarily about black women, because fibroids become symptomatic in black women some 5 to 10 years earlier on average than in white women. And it's typically during the childbearing age group that we see most of the symptomatic fibroids in black women. The different symptoms, heavy bleeding, again, is a real problem, and that needs to be corrected and treated in some way before the woman attempts to become pregnant. That's usually our recommendation. If a woman tries to become pregnant with certain fibroids in a certain location, like fibroids inside the uterus, for instance, that could prevent a woman from becoming pregnant in the first place. But if she manages to become pregnant and she has a fibroid inside the uterus, that's in the same area where the baby is growing.
Yeah.
And this, in turn, can cause premature deliveries. It can cause abnormal presentation such as a breech presentation, or what we call a transverse lie. It can cause the baby to be lying in positions which are not helpful for the delivery of the pregnancy. If a fibroid grows rapidly during pregnancy, part of that fibroid can die, and that produces a tremendously severe pain, which frequently requires hospitalization. It is not, the pain by itself is not dangerous for the baby or for the pregnancy, but it is very, very bad for the woman. And pain relief during pregnancy is something that has to be done in a special way. Special drugs need to be given, and very often that woman, as I said, needs to be admitted to hospital. So there are various ways in which fibroids can affect pregnancy.
Yeah. How are fibroids treated?
Well, at this stage, we have a number of treatment options. Now, the one treatment option that always corrects, always treats the symptoms caused by fibroids is hysterectomy, removal of the uterus. But in my judgment, that should always be the last option. A woman should not have to lose her uterus just because she has fibroids. Sometimes we have no choice. But that's the last option, but it is the perfect treatment because it gets rid of the fibroids once and for all. There are other non-surgical treatments. There are certain medications that can be used to reduce the size of fibroids, to make them smaller. And also, these medications can reduce the amount of bleeding that a woman gets from fibroids. In addition to those drugs that we use to treat fibroids, there are what we call minimally invasive treatments, where we do not use the major surgical options. There is one called embolization, for instance, where we try to block off the blood vessels that feed the fibroids. And by doing this, we cut down immediately on the bleeding caused by fibroids, and we also reduce the size of the fibroids. That procedure is called embolization, and we can talk about that later on if you want. And then there are smaller operations, which we now use, laparoscopic operations or belly button surgery to treat fibroids, and we can actually remove fibroids that way. And then there's a bigger operation called a myomectomy, where we can remove some or all of the fibroids and leave the uterus intact. And then finally, the biggest operation, which is hysterectomy, which removes the whole uterus and therefore all of the fibroids. So,
what about fibroid ablation? Is that a form of treatment?
Yes, I didn't mention that. That's a good form of treatment, and that is used specifically for fibroids on the inside of the uterus. there is an operation called hysteroscopy, which allows us to go in with a small, going through the vagina into the uterus without cutting the uterus, and either ablate or cut out the fibroid. Ablation just means destroying the fibroids using some kind of electrical power. But so we can do that, or we can cut out the fibroid and remove it piecemeal that way.
Quite interesting. Are there natural remedies or exercise that can help to relieve these symptoms?
I don't know of any. Exercise is good in that it helps the woman to keep her weight down. And as we said last week, excessive weight gain is associated with increased growth of fibroids. But there are no other lifestyle changes that I can think of that will influence the growth of fibroids.
So food has no contributory factors?
Yeah, well, food can.
I guess that's where the weight, depending on the type of food.
Well, that's right, yes. Red meats, for some reason, seem to have an influence on the growth of fibroids. And fatty foods and any excess caloric intake, which will cause you to gain weight, will also seem to increase the likelihood of your fibroids growing.
So would you say a vegetarian diet for a woman with fibroid is a good thing?
I can't make a direct association, but it seems to make sense. Because if a woman cuts out red meat and only eats vegetarian food, I would think that is less likely to make her fibroids grow. But I've never seen any actual studies which suggest that this should happen, that this would happen. It's something that I think is worthwhile studying, because a vegetarian diet is now very popular in many different groups, especially among our people.
Yeah.
And it would be good to see a study on the impact of a vegetarian diet on the growth of fibroids.
That would be interesting indeed, because especially for Seventh-day Adventists who recommend a vegetarian diet, it would be good for a study to see how many women end up with fibroids or without fibroids.
Yeah.
Is hysterectomy the best long-term treatment option for controlling excessive bleeding and pain?
Well, it depends on how you define best. It is certainly the most effective, because once the uterus is gone, there is nothing to bleed. But hysterectomy has its own risks and its own complications. And I would never recommend hysterectomy as the first choice for abnormal bleeding of any kind, whether it be from fibroids or other things. I think it should be, like all surgery, the last resort. There are simpler methods, much simpler methods, so one would hardly ever jump to hysterectomy initially. There are lots of medications that can be used very successfully to control heavy bleeding. And then there are other techniques such as we've been discussing.
Is hysterectomy, there's a cutoff, or rather, is there a cutoff age for hysterectomy?
You mean?
For someone with having fibroids.
With fibroids. There is no absolute cutoff age. However, as a woman gets closer to menopause, we think long and hard before we recommend hysterectomy. Because we know that menopause brings symptomatic fibroids to an end. After menopause, fibroids are no longer a problem. So if a woman is getting close to age 50, we try very hard not to do hysterectomy for the treatment of fibroids.
So what's the option in that case? See a woman 50 with fibroids.
Well,
what would be the treatment?
there are good drugs that can be used to on a temporizing basis. There is a drug which many people have heard about called Lupron, and this is one of a certain category of drugs that has been used for many years very successfully to control the heavy bleeding caused by fibroids. And this drug can also reduce the size of the uterus and reduce the size of the fibroids. Now, everything has a consequence, and this particular drug has its own side effects. But on a short-term basis, it is very effective and very good to use to treat the bleeding caused by fibroids. So in a woman close to menopause, it is quite appropriate to consider using this drug to treat fibroids.
And just for audience sake, what's the name of that drug?
The trade name that most people will hear is Lupron, but I'm not trying to advertise for the company, and I must tell you that that's probably the commonest drug of its type. But there are other drugs of the same category of drugs which are not as familiar to the audience, which will do the same thing.
Thank you. At this time, we'll have a break, and we'll have Pastor Hurlock singing for us again.
Like the blind man, I wandered, so lost and undone, a beggar, so helpless, without God or His Son. Then my Savior in mercy heard and answered my cry, and oh, what a difference since Jesus passed by. Since Jesus passed by. Since Jesus passed by. Oh, what a difference since Jesus passed by. Well, I can't explain it, and I cannot tell you why. Since Jesus passed by. All my yesterdays are buried in the deepest of the sea. That old load of guilt I carried, it's all gone, praise God, I'm free. Looking for the bright tomorrow where no tear will dim the eye. And oh, what a difference since Jesus passed by. Since Jesus passed by. Since Jesus passed by. Oh, what a difference since Jesus passed by. Well, I can't explain it, and I cannot tell you why. And oh, what a difference. Oh, what a difference. Oh, yes, I know what a difference since Jesus passed by.
Thank you, Pastor Hurlock, for that lovely song. We're back with Dr. Joe Daly, and we're talking about fibroids. And what advice do you have for women who are feeling discouraged by the severity of their symptoms?
They need to speak with someone who has expertise in the management of fibroids. Unfortunately, not everybody is able or willing to take the time to speak with the woman, to explain what is happening, and to tell her what her options are. I think it's useful for her to speak with other people who might have had similar symptoms and to see whether they were satisfied with their healthcare provider, and maybe try to get an audience with such a person so that they can sit down with them and tell them about their options. There is always an option to treat symptomatic fibroids. Something can always be done. A woman just needs to understand what the options are, and she needs to feel that she is in control of the process. The woman needs to know that she is a partner with the healthcare provider. And because this is a benign disease, it's not a cancer, there is no need for people to consider radical therapy. There are always a variety of ways in which the problem can be handled. And I think if most people understand this and they see that they're respected and their views about what they want to have done are respected, that most women will feel comfortable going forward.
Yes, and it's good to know that for our audience sake, fibroids are never cancerous. That's right, Doc?
You can't say that too often.
Yeah.
It's something that
fibroids are never cancerous.
Yeah, yeah. We need to remember that.
Yes. What advice do you have for husbands when it comes to being understanding or more understanding in helping their wives cope with what can sometimes be very debilitating side effects of having fibroids?
I think it would be a good idea if husbands always went with their wives to the person who is providing care for for her fibroid condition, so that the pathology is explained to him as well, and so that he gets a good picture of the kind of problems that his wife or his partner is experiencing and can experience, and he understands how debilitating fibroids can become. There is hardly anything, in fact, I don't think there is another condition that causes as much debility in women as fibroids do. There are times when the husband is going to have to be fully understanding. He's going to have to be empathetic to his wife, and he's going to be called upon to do things which he would not normally do. And I think if people are reasonable, that they will apply themselves and do whatever is necessary to be supportive to their wives.
Dr. Daly, thank you so much for taking the time out to inform us about our health, and we appreciate all that you have done. And to our audience, thank you for listening in, and I'm sure you have learned quite a bit. Dr. Daly, thank you so much. On behalf of Revelation Revealed Ministry, we would like to present to you this token of appreciation, and this is one of our latest CD for Revelation Revealed Ministry, and we hope you will enjoy it. And to our audience, you after Sabbath, you can go online to rreveal.org, where you can get your CDs and your books, Revelation Revealed Ministry. Thank you so kindly.
Well, Sister Norma, I'm just so grateful for being able to address the audience tonight, and I feel greatly honored that I've been asked to do so. And I thank you very much for the gift. You know how much I appreciate your husband singing, and I'm very grateful that that you honored me with this gift tonight.
Yeah. And there's a little something in there which I'm sure you will like, but we'll keep it just between us. Thank you so much.
Thanks.
You may be seated. We are so grateful that God has provided medical professionals like Dr. Daly to inform us about our health. Thank you once again for tuning in. As you sleep tonight, go with the assurance that God is with you. In 3 John 1 and verse 1, he promises that his desire for us, God's desire for us, is to be prosperous and to be in good health. So whatever you're going through, call upon him. He will never fail you. He's waiting to hear from you. God bless you, and we'll see you. Good night.